Characterization of functional and histological changes of the urethra in rat models of stress urinary incontinence (SUI) induced by simulated birth trauma or estrogen deficiency. I have no COI. Stress urinary incontinence (SUI) is a common problem in elderly women. Multiple vaginal parities and estrogen deficiency are considered to be important risk factors of SUI. Thus, animal models of simulated birth trauma induced by multiple vaginal distention (VD) and estrogen deficiency induced by bilateral ovariectomy (OVX) have been used to study the SUI pathophysiology in rats. Serotonergic paraneurons uniquely located in the urethra can modulate urethral sensory function and that their numbers decrease in aged or diabetes rats. However, the difference of changes in the urethra in different models have not been well characterized, especially regarding epithelial morphology and expression of 5-HT-positive paraneurons in the urethra. We therefore evaluated the urethral histological changes of the epithelium and 5-HT-positive cell expression and urethral continence function in rats with OVX-induced estrogen deficiency or VD-induced simulated birth trauma. Adult virgin SD rats were divided into 5 groups: sham, VD1, VD3, OVX 3 weeks, and OVX 6 weeks. VD was induced by balloon catheter inflation in the vagina. In VD1 group, VD was performed once 2 weeks before the evaluation. In VD3 group, VD was repeated every 2 weeks for 3 times, and the urethral evaluation was performed at 2 weeks after the final VD. In the OVX group, the urethral evaluation was performed after 3 or 6 weeks of bilateral ovariectomy. Urethral function was evaluated by a microtransducer-tipped catheter. UBP, urethral baseline pressure, and AURS, amplitudes of the urethral responses during sneezing were analyzed. Histology of urethral tissue, H&E, immunofluorescent detection of 5-HT-positive paraneurons. RT-PCR in urethral tissue, messenger RNA level of tryptophan hydroxylase 1, TPH1, a key enzyme of 5-HT synthesis. UBP were significantly decreased in OVX 6 weeks and VD3 rats compared to sham rats. AURS were significantly decreased in OVX 3 weeks, 6 weeks, and VD3 rats compared to sham rats. The epithelial thickness were significantly decreased in OVX 3 weeks, 6 weeks, VD1 and VD3 rats compared to sham rats. The number of 5-HT-positive paraneurons were significantly decreased in OVX 3 weeks, 6 weeks, VD1 and VD3 rats compared to sham rats. Messenger RNA levels of TPH1 were significantly decreased in OVX 3 weeks, 6 weeks, and VD3 rats compared to sham rats. The two SUI models exhibited similar urethral dysfunction evident as reductions in UBP and AURS. Urethral epithelial atrophy and loss of 5-HT-positive paraneurons occur in both models, but these changes occur rapidly at OVX 3 weeks compared to VD1 group. Thus, the tissue damaging process in the urethra could be different between OVX and VD. Thank you very much.